Trifoletti. Dr. Trifoletti, any update on the PANDAS research that you've been doing?
Yes, we have some early results on some of the children. I can tell you that they are testing positive for, each one is testing for either streptococcus or mycoplasma, which is our known triggers of the PANDAS syndrome.
Now, I assume you were testing for immunological activity of those having been exposed. So how do we distinguish between sort of routine environmental exposure and something that would cause PANDAS?
In fact, follow-up studies may be needed to determine whether there's a rise in titers. But these are tests that would normally be accepted as showing evidence of either streptococcal carriage or mycoplasma exposure.
Okay, so let me, for people out there that are first coming to this program, help you understand that what PANDAS is a post-infectious autoimmune disturbance, meaning your immune system attacks parts of your brain, and immunological titers, meaning these antibodies we can test in the blood, go up, and they can change with time. That's what Dr. Trifoletti and I are discussing right now. And Dr. Trifoletti has believed this entire thing might be an infectious outbreak. And as I'm hearing you talk tonight, Dr. Trifoletti, that would be your provisional impression.
That's right. I think that's one of the main factors and probably the most easily reversed factor here. And we're already talking to the families about starting treatment based on this.
Which would be an extended course of antibiotics, I presume?
Course of antibiotics and possibly corticosteroids as well.
Okay, very interesting. Are you working with Dr. Meckler's team?
No.
Oh, boy. Are you having any communication with them?
Not yet.
I hope that becomes a collaborative effort, because, boy, it's having two, could be tough for the patients when competing opinions of doctors don't sort of collaborate on these things. But thank you, Dr. Trifoletti. I really do appreciate this input and sharing it with us. And I hope this does bear fruit. I mean, my goodness, wouldn't that be nice to know that this ends up being not an environmental phenomenon? And I'm watching my stage manager, Dave, here, and some of the cameramen shake their head. Yeah, what a relief that would be if we have an answer. But it's very difficult to nail down PANDAS. What do you guys think of that? You're a nurse.
I think that it makes more sense to me than the conversion disorder, because I know my daughter, and I know that she doesn't have the symptoms of conversion disorder. She's never had anything traumatic in her life that broke the camel's back.
Well, you've had a lot of operations. Do you mind me sharing this? That
No,
maybe
not
that
at
was
all.
somehow something that really got through to her in ways you weren't aware of.
Yeah.
It'd be tough to have mom
Yeah.
having operations. I mean, you're fine, obviously,
Right.
but
well,
but
I'm still sick.
But
I
it might have
mean,
scared
yeah,
her and caused
yeah.
something. Lana, your daughter have any serious trauma, stresses in her life?
No.
So for you, that would be mysterious.
Yeah, she's had a lot of strep throat
So she has had these
issues.
infections.
And a year ago, this past November, she had her tonsils taken out.
So clearly she has had strep. The question will be, did the strep cause this? So her titers will be up for sure. The question is, she be somewhat at risk for it? Again, to explain to people we're talking about here, this PANDAS syndrome is something that we used to see back in the days of rheumatic fever and scarlet fever all the time. It was called St. Vitus dance or Sydenham's chorea. People would get these weird movements after strep infections because it would attack the brain after a prolonged infection. Dr. Sharp, let me go back out to you. What do you think? So we've got the PANDAS now. We've got conversion being diagnosed by Meckler's team. We've got two different doctor groups treating patients. It's getting a little confusing for patients. What do we do for them?
We get everyone talking. We definitely have a consolidated treatment group. I think you're so right that Dr. Trifoletti ought to work with Dr. Meckler and try to coordinate the care. And we want to focus on treatment. You know, psychiatry can offer support. So if this is emotional distress, that should be factored into treatment. If the emotional distress is primary in terms of causing it, then obviously that should be factored into treatment. Cognitive behavioral therapy is included in PANDAS treatment, as well as in tic treatment, as well as in the treatment of conversion disorder. I want to see these girls in frequent, constant treatment to get them better.
So again, supportive caretakers, maybe specific kinds of psychiatric methodologies involved will help. And we've all been thinking here, it's sort of a mixed bag here. Maybe environment, maybe PANDA, maybe conversion. So in any of those cases, what Dr. Sharp is talking about would be helpful. Would you guys be willing to participate in those kinds of treatments?
Psychiatric?
Yeah.
Counseling?
Well, whatever. Dr. Sharp started talking about ways of managing being sick, really,
Right,
or
right,
actual
right,
specific therapy for conversion.
No, my daughter is seeing a counselor
Oh,
to
she's
help her
seeing-
deal with her sickness.
Okay. And Lana?
Most definitely.
I mean, it's a
I
very
would be.
stressful time in the community. It would be helpful, I would think, whether or not the
Absolutely, for
conversion.
everybody.
Right. Whether
Yes.
You seem very comfortable with that. I mean, you're a nurse. It's something
Yeah,
that.
I mean, I'm comfortable with
Yeah.
going both ways, but I still feel that, you know, she had mono a year and a half
We
ago.
got to keep looking. Well, listen, you see, we are. We're going to stay with it until we come up with some harder answers. We appreciate it. So, ladies, Lana and Beth, thank you so much for joining us. Dr. Sharp, thank you for that input. And of course, Dr. Trifoletti, thanks for sharing your results. Up next, more about what might be causing the